welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And today's guest is going to do just that. His name is Andy Crowder. He's Senior Vice President and Chief Information and Analytics Officer at Atrium Health. Welcome, Andy.
Hey, excited to be here, John. Look forward to the conversation today.
Yeah, so before we dive into the topics, tell us a little bit about yourself and Atrium Health.
Yeah, so Atrium Health is a phenomenal organization, about 42 hospitals. We're in 4 states right now and expanding. 70,000 teammates just completed our integration process with Wake Forest. I've been with them about 18 months and spent some time on the West Coast with Scripps Health and then Ambient Health and some other health systems on the East Coast. Well, glad to be back on the East Coast, though.
Yeah, we may have to talk about what's East Coast versus West Coast. You'll have to share the differences.
They're pretty significant.
Oh, that's great. Well, I hope you incorporate them in your answers. So,
Yeah.
what's the biggest operational challenge that you face right now, and what are you doing about it?
Yeah, so Atrium Health has been a leader nationally related to the pandemic, both in the testing and in the vaccination process with our mass vaccinations, Charlotte Motor Speedway, Bank of America, Panther Stadium, a lot of great clinical leadership, and then partners with Honeywell and many other large tech industries, firms in the industry. The biggest challenge, I think, has been managing all of the digital acceleration strategies and initiatives that we already had going on, almost $750 million worth of initiatives at the same time that a pandemic was going on, and really just trying to find a way for balance. And Rasu likes to call it the next normal, or us recalibrating to who we're going to be in the middle of all of those. So really balancing those competing and sometimes complementary initiatives has been the biggest focus or the struggle, I think.
Yeah, I think that's really interesting because where they align, you're like, oh, good, we're on the path.
Awesome.
But where they're not, you're like, wait, so what do we choose, right? How do you make that approach? Like, how do you prioritize competing things that are both beneficial to the organization and to the patients?
I think it really speaks to leadership and making sure that we've got great governance processes in place. So IAS had embarked on a very robust digital acceleration strategy and a governance process to really engage the key stakeholders, but keeping in sync and keeping the CEO leadership, CEO council engaged as we're ideating through that to provide, you can't make all of the right calls, but if you can have clarity as a leadership team about what you're doing and stay connected, it can provide you the ability to compensate and redirect where you need to. And so I think the thing that's really proved a bright spot for our organization is just how leadership has stayed connected and ideated through this conversation and made the adjustments when you needed to.
No, that's great. And then everyone's on board, everyone has the vision, that's a great approach. So what are some of the biggest technical challenges you're facing right now, and what are you doing to deal with those?
Yeah, it's interesting. I saw the question. I don't think that we've actually had any what I would call significant technical challenges. I think going to your point is that when you take the pandemic and what it brought around virtual and virtual care and some of those things, we had great adoption, but we really hadn't crested the summit and doubled down on some of these strategies and made them part of who we are. And this certainly accelerated that during the pandemic because you had no other way to reach many of your patients and your consumers. The same thing on our work remote strategy, Skype to Teams and some of the other transitions. The pandemic forced us over the edge to really sell out on some of those strategies. And so it was really just managing the velocity of all of that at one time and making sure that you could hit the brakes when you needed to. But in many cases, it was accelerating some of those strategies, not hitting the brakes. And then it did provide great clarity on what you would say no to, though. And really, it did help reaffirm the strategies that we had in place. So I think it was actually clarifying for us, to be quite honest. But technical challenges, Atrium Health had made the right investments in some of the enterprise strategies, Epic, Oracle Cloud, OneCloud, some of the other consumer and digital initiatives, that $750 million investment. So the technical challenges weren't around, did we have the money and did we have the budget and have we made the right sure bets? It was really around focusing around which strategies during the pandemic accelerated those and how to say no to the ones that didn't.
Uh, I think that's fascinating from two areas. The first is that you had to invest up front, and because you did, it paid off. I think we've heard that message over and over during COVID. I have from many CIOs. But the other one's interesting too, that there aren't technical challenges, which I think is fascinating. And I don't, I'm simplifying what you said, but many CIOs want to be the turn the lights on CIO. And to me, that seems like a mistake as we look going forward, because the challenges aren't technical. The challenges are more process and business related and prioritization and workflow, et cetera. Is that how you see it as well?
Yeah, I see the challenges. It's no longer about keeping the lights on and making the right technology decisions. As long as your organization's in the right financial position, I think that most CIOs can get to that point and certainly leverage their vendor partners to get there and make the right decisions. It does really boil down to aligning the change management and the clinical business partners in which strategies catapult your business and which ones are just status quo. And so fortunately, some of the enterprise strategies that we've had in place have allowed us to really accelerate initiatives. Every one of our digital acceleration strategies is in a better place today as a result of what's happened from the pandemic and the clarity on it. And I think that there were maybe some pockets in the organization that didn't understand some of those benefits, but they certainly understand them today because all of those investments on the analytics and the BI and the predictive modeling and some of those other things that were soft and squishy before were what gave our organization great clarity on how to make the next right decision and the next right step. And it's paid huge dividends for our organization.
Yeah, if COVID did anything, it got buy-in for a lot of things that we didn't
Absolutely.
have it before. That's great. So tell me, what's the most exciting thing that you're working on now, and why does it excite you? Is it a technology? Is it a process? What excites you right now?
Yeah, so the areas that excite me the most right now, there are components around the consumer and digital aspects that are really, really exciting. Removing the friction spots from the consumer journey, connecting the ecosystem and the caregivers and their care teams. I think prior to the pandemic and COVID, there wasn't as much trust or buy-in. There's certainly trust and buy-in, and now you've got pent-up excitement and demand on how to work differently. So that's got me really, really excited. I think the other one is centers around predictive analytics and leveraging the tools to find the next right thing to do and the next right question. And we're still very nascent from an organizational point of view and an industry, but the predictive component and really using data to harmonize what you do and how you do it, I think has really just grown exponentially again. I think the pandemic has been, in many cases, a CIO's friend in accelerating some of the strategies. And those are probably the two things that excite me the most. I think probably the third one, we didn't know what the pandemic and work remote would do to these enterprise strategies and collaboration. I think the hard part is finding balance and self-care on when to turn on the light in the morning and when to turn the light off in the evening time, because days can go on 12 and 14 hours. But I've seen our teams be able to be more productive and lower cost on these major initiatives, which allow us to retool and refuel back into the organization a very different way. So those are pretty exciting things.
Yeah, that's really exciting. The first one I love it. It's basically saying we're putting patients first. That's a good message that I think a lot of patients would appreciate, because hasn't always been that case in some of the technology efforts.
Yeah.
The second one is interesting in a different way. Are you applying it, do you think, more to like the patient engagement experience, or are you applying kind of that next best action to the clinician experience, or where do you
Both,
see it going?
both, both, both. We, if you look at some of our voice of the customer, voice of the consumer activities, listening in a very different way, representing and putting the next choice that a customer wants. They interact with us. I think we take, I'm going to mess up this stat, but let's just say 100,000 calls on a weekly basis. And that's the same type of interaction over and over again, but are we really giving back that person that's engaging with them the preferences of that consumer, what they like and what they dislike, so that they can have a more meaningful relationship and know the consumer at a different level. We're starting to bring those technologies to bear now, and we think it's making a huge difference. It's increased our brand rating, it's increased our customer satisfaction rating, and those data and insights are fed back into the contact center and back into the caregiver's cockpit real time right now. Those things are going to pay huge dividends for how we change the solutions that we put together.
That's excellent. And of course, the remote work, I think, just the fact that you and I could do this video call without even a pre-meeting, without like, it's amazing. The technology just works now for everyone because, well, we've probably done too much Zoom, let's be honest, but it's powerful. So as you look at your role as CIO of a large and expanding organization, how do you think that role is going to evolve over the next, say, 5 to 10 years? And what are the things that, CIOs like yourself should really be paying attention to?
Yeah, so I think the transformation started many years ago, but it's really, it's not about being the technologist. While the technology has to work and you have to have the right vendor partnerships, it's about being a member of the executive team who happens to have a focus in the IT arena. And you have to up your game and be part of their solutions and the organization's strategy. I think that changed many years ago for most of us. And what's interesting too is the focus now on digital. And you see a lot of CIOs with digital in their title or analytics in their title. I think that's just a forward statement about how critical and how vital the role that IT plays in an organization's success. Without those components, organizations can't even take a single product to market anymore. You've got to have those pathways. And so I think being a business enabler, partnering well with the rest of the executive team, and being in the strategy conversations is really, really key. And that's paid huge, I've only been there a year and a half, but based on the amount of interactions we've had with our CEO, with the rest and the board and the strategic members of our community, it's really been accelerated over the past 18 months. It's been very encouraging. It feels like I've known the organization for a lot longer than I have 18 months in. It's built some really sound relationships, and minus this technology and some of the virtual components, it would have taken years, many board meetings and presentations. And, we've gotten through in a year what would sometimes have taken 5 to 7 years to get through. And so that's built an agility and a capability that I hope doesn't go away.
Yeah. Well, and just your comment about the title, it's fascinating to see how that impacts the perception of you as a leader. And I've known a lot of CIOs who have done that, where they're often using chief digital officer even
Right.
to say, hey, I need to have a more focused role around the conversion to digital than just being the information officer. And I think analytics does it as well. I mean, I think it's interesting you have chief analytics officer. And I think it probably comes depending on how you were raised through the industry, right? Too, do you come from the analytics side? Do you come from more of, a marketing or, patient experience role? Determines that. But it's interesting. I think the title impacts how they think about you. Is that what you've experienced?
I do think the title has relevance in how they think about you, only if the way that you act and the way that your leverage teams brings benefit to that, to the title and to
Gotcha.
those different sets of activities. If you have the chief digital officer or the chief analytics officer, and your resources aren't aligned to meaningfully improve the capabilities in the consumer and the digital journey, it's not going to, it's just a name, it's just a title.
Sure. That's fair.
When I think about where I spend the majority of my time, I would tell you that, when I think about the chief marketing officer, when we were in the office, his office was right across the hall from mine, and we shared the same executive assistant. When you look at the strategies that we have in place today, significant amount of our efforts are around digital in the consumer side of the house, analytics and the deep insights to improve that and to improve the care delivery, which is why we announced a new chief digital officer role and analytics. So in our organization, Omar Awan has pulled all of the BI, all of the analytics components together, along with the digital and the consumer MarTech stacks. And so he owns that entire continuum. We believe it's going to pay huge dividends for us in the months and years to come.
Yeah, I've been arguing that for a long time, that many of the solutions we need in value-based care are
Right.
really marketing solutions.
Yes.
And
Yes.
yet our marketing person, I was at a Twitter chat today, or someone's like, why isn't the marketing person being more involved? And I jokingly tweeted, they're too busy working on the website, which is a travesty when that's the case, right?
Right. Yes.
No, so
Yeah.
it's great that
Yeah,
you're working.
travesty.
So are there other areas that you're really paying attention to? Are you looking at ambient clinical voice, or, are there other things that you're kind of keeping an eye on to see how they evolve and ways you can incorporate them into your organization?
I mean, I'll just speak to the strategies. Becoming the next academic, creating the next academic teaching model for the industry is significant to Dr. Julie. That's why the whole relationship with Wake Forest is significant. A different way of attracting the next leaders and the clinical caregivers is significant to our organization. I would also say that we have two other strategies: the Connected Care Everywhere, which talks about how you connect with all. That's part of our For All mission. And those with significant health disparities is really important for our organization. It's important for our industry, and we've seen what happens to different races and ethnicities as a result of COVID. Our Black and African Americans, some of the other communities really hit hard. So the work in that space and the data insights and the interventions and the way that we connect in those communities has been very different and made a huge difference. We've been able to close health inequities in certain of the markets that we exist by leveraging the data to take different interventions. It's not a one size fits all. That's exciting. And then I think the next thing for me is it's at the end of the day, regardless of how much tech we put anywhere else, it's about humans and the best clinical physicians and clinicians caring for people. And if you don't take care of them and that front line taking care of the patient, you'll never be able to do these great things. And so it does, and that's around our best place to care strategy. We've got to create the best place to care so that we can care for the best in all of these markets that we serve. And so those are a couple of the themes that I think color the landscape of the view that I have on what we do and make it really meaningful from an experiential point of view.
Yeah, amazing that you went back to your high level strategies. That's a good CIO right there in my book.
I've got some people in strategy that help me make sure that we're doing that all the time. So
That's impressive. So as we kind of wrap up here, I like to give some people who are maybe aspiring to be a CIO, aspiring to be in your position, some things to think about. So what kind of things do you think set you apart that really helped you become a CIO that some others that, maybe aspiring to the position could do and learn from your experience?
Yeah, so one of the first things is that, somebody took a chance on me. They saw something in me that quite honestly I didn't see. I thought when they said, you'll make a great CIO one day, I hadn't even thought about that from a role or a career point of view. Surrounding yourself with people who have skill sets and opinions and perspectives that you don't have is really, really important early on. I think the second thing is, staying true to yourself and focusing on people, relationships, and getting the job done. I mean, at the end of the day, there's nobody that's in the CIO role that's been successful at it that didn't find a way to find yeses, focus on their customer, and get results when others have said no. So your results do make a difference, and how you align with people makes a significant difference.
Yeah, it's amazing how much a CIO job is about people. So that's some great advice. Well, thank you so much, Andy. I appreciate you being on the Healthcare IT Today CIO podcast. I loved your insights, and thanks everyone for watching and listening. If you want to find more great health IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Andy.
Hey, have a fantastic day. Thank you so much.